Hello. Thanks for joining us for this episode of Innovations in Vital Care. Today, I'll be speaking with Dr. Jan Willem Gorder and Dr. Christina Grant about an amazing app that's making a vital difference in the lives of adolescent patients at McMaster Children's Hospital. Thanks so much for joining us today. Could you tell us a little bit about this app and what it's used for?
It's a great opportunity to explain you a little bit about the My Transition app. It's about young people taking charge of their own health when they grow up and become adolescents and young adults. And we want to help them and provide them with the tools to really learn those skills. Young people with chronic health conditions and with disabilities, and that can be a physical health challenge or a mental health challenge in general, have a difficult time and struggle navigating the adult healthcare system once they leave the children's hospital, as well as learning how to follow up, for example, with appointments and looking after their own medication.
These are tools that a team member, whether it's the physician, a nurse practitioner, or a social worker or child life, can actually engage with the young person by them downloading it on their phone, being with them in clinic, whether it's virtual or not, and kind of going through some of the questions.
I'll explain you briefly the different tools that are integrated in the app. The first tool is it's called the Transition Queue, which is a 14-item questionnaire where the youth can indicate whether or not they are taking charge of specific skills, for example, answering a doctor's questions or making their own appointment.
What the care provider can do with the young person is actually look and see what are the areas that they may want to work on in terms of getting more of that independence. And so then it can be kind of like a tailored intervention where the healthcare practitioner knows exactly what to focus on.
The second tool is a 3-sentence summary where the youth are prompted to practice to briefly summarize their own health condition, their medication or their treatment plan, and a question they have for the healthcare provider.
Often in the adult world, if you imagine a busy emergency room, there's about 30 to 60 seconds that young person has to kind of get out the salient, important facts about their medical condition for the healthcare team that's seeing them that day.
And the third tool is a tool that was developed in Toronto. It's called My Health Passport, where youth can summarize their own health information.
The young person can go in and literally create like a passport, but for their particular medical condition.
Because it's handy to have your own health information at hand if you are not in the clinic where you used to come and people know you, but seeing a doctor that doesn't know you so well.
When we're thinking about caring for these young people, a really important part of caring is celebrating that next step of them actually being well enough and growing up to be able to go and lead adult lives. And so a really important part of caring for them is making sure that they have a solid team and connection with the adult providers that are going to take over their care when they turn 18.